Not knowing whether you're pregnant or not can be really tough. Whether it's between ovulation and waiting for your period to start, or you're doing fertility treatments and it's after the IUI, it's after the embryo transfer, or maybe you're not trying, but you're just worried. No matter why you want to do a pregnancy test, if you want to know when you can test, how early you can test, and how accurate that test is going to be, you want to watch this video. Welcome to my YouTube channel. I'm a double board certified OBGYN and reproductive endocrinologist helping people build families for years. And one of the most common questions my patients ask are, when can I do a pregnancy test? You know, when you are trying, that's most of my patients are trying to conceive, often doing fertility treatments. People want to know, when can I know? It's that we call it that 2-week wait, because typically after ovulation, about 2 weeks later, you can expect a period if you're not pregnant. That's why it's called the 2-week wait. It can be excruciating. I've actually got a whole video here on the 2-week wait. It's one of my most popular videos, kind of tips and tricks to help you during that difficult time. I've also got another video here on sort of early pregnancy signs, right? Because you just want to know. And so a pregnancy test can be a way to know if you're pregnant or not, but it can get confusing and people want to know, well, how early after ovulation? How early after the embryo transfer? And that's what this video is about. This video is all about pregnancy testing and accuracy. In this video, we're going to cover a couple of topics. Number one, we're going to go over what pregnancy tests are, what they're testing for, and what options are available. Number two, we're going to go over when to do a pregnancy test. Like, how early can you test after a treatment or after ovulation and get an accurate result? That leads into number three. We're going to go over the accuracy of pregnancy tests. And then finally, number four, we're going to talk about why your fertility clinic tells you not to test at home. So this is really common, and I know that my patients often do test at home before they come in for the blood test, especially after the embryo transfer. But a lot of fertility clinics will advise their patients not to test at home, just wait for the accurate results from the blood test from the clinic, especially after an embryo transfer, and I'll let you know why. Now that's a lot to cover, so let's get started. So first of all, what is a pregnancy test? A pregnancy test is measuring a hormone in your body called HCG, or human chorionic gonadotropin. In simple terms, if you test positive, then you are pregnant. And if you test negative for HCG, you are not pregnant. In more accurate and medical and scientific terms, human chorionic gonadotropin is a hormone made by trophoblastic cells within an embryo. And these trophoblast cells will eventually become part of the placenta. So it really is a hormone that's actually coming from a developing pregnancy, which is why when you test positive, you are pregnant. Test negative, you are not pregnant, but it gets a little nuanced. A positive HCG, or a positive pregnancy test, means that you're pregnant, but it doesn't necessarily mean that it's a healthy pregnancy or that 9 months later you are going to have a baby, but it can tell you whether you're pregnant or not. So a pregnancy test for HCG can be done in one of two ways. You can find this hormone in urine, so you can do a urine pregnancy test, and you can find this hormone in blood, so you can do a blood test to test for HCG. Now, urine pregnancy tests are considered qualitative tests because it's just if that hormone is present in the urine, then you are pregnant. And if it's not, you're not pregnant. This is something that you can do at home. There's a home pregnancy test where you can pee on a stick and see if you're pregnant. So a blood test for HCG is considered a quantitative test because it not only tells you that you're pregnant if it's positive, but as the pregnancy develops and as there's more and more of those cells making more and more HCG further along in the pregnancy, you can actually quantitatively see that level increase. So it can give you clues on the development of the pregnancy. And if the pregnancy level, the quantitative falls early in pregnancy, you know that that can actually be an early miscarriage or a biochemical miscarriage. So the home tests with urine are kind of qualitative. It's like yes, no. And then the blood tests in the clinic where you're getting numbers is more of a quantitative test and can be used to kind of follow pregnancy until you get to the point where you can see something on ultrasound. So when can you do a pregnancy test? So the cells within the embryo start making HCG as early as 6 days after ovulation. The HCG hormone is actually made by trophoblastic cells as early as 6 days after conception. And conception is after the egg and sperm fertilize. The embryo has been developing for about 6 days. days, then you can actually find that hormone being made within an early embryo. However, most home pregnancy tests will not turn positive until about 10 days after conception. Now, there are some early detection urine pregnancy tests at home that can test positive as early as 8 days after conception, but they're not as accurate. Remember, a negative pregnancy test, especially if you're checking early, might not necessarily mean that you're not pregnant. It just could mean that the hormone level is so low that the pregnancy test can't pick it up. So if you're checking early and it's negative, maybe check again in a couple of days because you might pick up on that early pregnancy positive test result. The most accurate time to do a home pregnancy test is the day that you expect to get a period, which is approximately 14 days after ovulation. If you do not get your period on time, you are late, and you do a home pregnancy test and it's positive, that is the most accurate sign that you are pregnant. You can learn a lot more about timing intercourse and tips and tricks for ovulation from a couple other videos I have here. One video called Baby Making Sex tells you all about how to time intercourse and how often based on your cycle. And I have another video like how to tell if you're ovulating, that you can figure out physical signs and then testing that you can do at home to figure out when you ovulate. That can really help with timing. All right, so how accurate are these test results? Remember, the test is most accurate the longer that you wait. So the closer you test to a missed period, about 14 days after ovulation, the more accurate the test is going to be. Different brands make different claims on their accuracy, and I have a list here for you. So first response early pregnancy tests are 76% effective 5 days before your period is due, and more than 99% accurate 3 days before your period is due or later. Clear Blue early pregnancy testing says that it's 71% effective 5 days before your period is due and 98% effective 3 days before your period is due, and more than 99% effective 2 days before your period is due or later. The Clear Blue digital pregnancy test says it's 75% effective at detecting a pregnancy 3 days before your period is due and more than 99% effective the day before your period is due or a little bit after. And the last one that I could find some information on for you is the Natalist pregnancy test, says it's 99% effective 2 days before your missed period. Now, the final point, why does your fertility clinic tell you not to test early? It is so common for fertility clinics to advise patients not to do this. So the thing is, even if you test early, the reason fertility clinics say this is because they don't want you to take action on the results. Sometimes there are false positive pregnancy test results. Sometimes there are false negatives. You have to be careful when you're doing a pregnancy test. You got to make sure, check the expiration date. You got to make sure you're checking it on time. If you do it early in the morning when the urine is more concentrated, you get a more accurate result. So there are times where people are actually pregnant, but they get a negative test at home, and the fertility clinic does not want you to stop your support medications early. So even if you test negative at home, still come in and get the blood test with your clinic, because we want to be 100% sure. This is just so important. And unfortunately, there are times where people get false positive tests at home, especially if they used HCG medication in their fertility treatment. So people often use HCG as a trigger to trigger ovulation, and then they'll do an intrauterine insemination. Or some people will use HCG in their IVF cycle to trigger ovulation, to get the eggs ready for that egg retrieval. Sometimes if you test early, you could get a positive HCG because that is the hormone. It's in your system. You'll get a positive pregnancy test the day after you take a trigger shot that has HCG in it. But that positive test is coming from the medication. It's not coming from the pregnancy. And that HCG medication can be in your system for up to 10 days. Now, most people clear it after 7 days, but there are rare cases where it's hanging out a little bit longer and people are testing early and they're getting positive pregnancy tests. But really, you should wait until you can get that blood test in your clinic to be 100% sure whether the home testing is correct or not. So in summary, wanting to know that you are pregnant as soon as possible is totally normal. Early testing is totally normal. I mean, I see these pictures on Instagram of people putting their pregnancy tests in a row, kind of like day 1 after ovulation, day 2, day 3. And people kind of joke about going to, buy their pregnancy tests in bulk because you're so anxious to know. It's really, really common. And having at-home pregnancy tests is wonderful to have access to this information, but it can often be confusing. So just remember, if you test early and it's negative, keep testing because it could show up later. And then also sometimes you can get false positive results. Either the test could be faulty or you could still have that HCG trigger medication from your fertility treatment in your system. So remember, when in doubt, retest, don't make assumptions, and be sure and ask your doctor for help or clarification if it's confusing at home. I hope this video was helpful. Like this video if you learned something, comment with questions that you have, subscribe to this channel so you get my weekly video. Make sure that you follow my newsletter. I will put the link in the description below. It keeps you up to date with research and what's going on in the fertility media. My latest videos, it's really a wonderful way to stay in touch. I really enjoy teaching and learning. Let me know topics that you want me to cover. And as always, stick around for more learning.